Hospitals and clinics are vanishing under Trump's healthcare reforms, leaving millions in a healthcare crisis. And this might just be the beginning of a storm that hits hardest where it's needed most. Healthcare facilities across America have been closing their doors or scaling back services in the mere for months since President Donald Trump put his signature on the One Big Beautiful Bill Act. This sweeping tax and spending overhaul is projected to strip health insurance from an estimated 10 million individuals, according to the Congressional Budget Office. To put this in perspective for anyone just tuning in, the bill is designed to significantly reduce government spending on healthcare, aligning with Trump's promises to downsize the federal budget. But it achieves this partly by tightening who qualifies for Medicaid, the U.S. government's lifeline for health coverage aimed at low-income families and individuals, and by hiking costs under the Affordable Care Act, often called Obamacare. Additionally, it pulls funding from certain family planning services, including those that provide abortions, which has sparked heated debates on reproductive rights. But here's where it gets controversial: is slashing these programs truly a path to fiscal responsibility, or is it sacrificing vulnerable populations for political gain? Rural hospitals and maternity wards are bearing the brunt of these changes, as they're often costly to operate and heavily reliant on Medicaid patients. Research from the University of North Carolina at Chapel Hill reveals that over 300 rural hospitals are now on the brink of closure or service reductions. An upcoming study by the National Partnership for Women and Families highlights that nearly 100 of these are in areas with no alternative for obstetric care. This disproportionately affects white, Native American, and low-income women, who could lose their only access to essential maternity services. The One Big Beautiful Bill Act isn't the sole culprit behind these shutdowns, explains Michael Shepard, an assistant professor at the University of Michigan School of Public Health specializing in rural healthcare. However, it could deliver the final blow to institutions already teetering financially, many that might have held on for years without these modifications. A thorough review by The Guardian uncovered that in 8 states, healthcare groups have cited the legislation as a key factor in their decisions to close facilities, discontinue services, or cut jobs. Here are some poignant examples. Georgia. In early October, St. Mary's Sacred Heart Hospital in the rural town of Livonia, Georgia, shut down its maternity ward, one of the first casualties of the One Big Beautiful Bill Act. The hospital had been grappling with a shortage of doctors and shifting population trends, but a spokesperson told us via email that the reductions in Medicaid funding clinched our decision. Expecting mothers are now advised to travel to a facility almost an hour away. Tammy Fry, who oversees the Heart Life Pregnancy Care Center, an anti-abortion resource center just a 20-minute drive from the closed hospital, shared how panicked pregnant women have been reaching out for guidance on finding new doctors. The center offers baby supplies and parenting advice but no medical care. Many of these women lack dependable transportation, Fry noted. They sounded terrified and distraught because they had built strong bonds with their doctors, Fry recalled. Imagine the fear if an emergency strikes during pregnancy, ***. And this is the part most people miss, how these closures ripple into personal stories of desperation and lost trust in the system. Kansas. By October, the Freeman Health System reversed its plans to launch a new hospital in a remote southeastern Kansas area. A detailed analysis showed it was impractical due to the uncertain effects of upcoming laws like the One Big Beautiful Bill Act and ongoing issues in rural healthcare, as stated in their official release. Maine. Maine Family Planning, operating 18 clinics statewide, has historically blended primary healthcare with family planning services, drawing roughly $2 million annually from Medicaid reimbursements. Yet, a clause in the bill temporarily bars major abortion providers from these funds, forcing the organization to halt primary care in October. Around 70% of their patients depend entirely on this service for their healthcare needs. Heather Curran, a primary care nurse practitioner in the isolated Aroostook County, described treating individuals who had neglected their health for years. Now, after a decade with the group, her position is gone, and she worries her former patients will face long waits or go untreated. I'm passionate about enhancing healthcare in Aroostook County and caring for my patients, Curran said. Many are struggling just to survive day to day. Nebraska. In Nebraska, the community hospital in the small town of Curtis is shutting its only local clinic amid financial strains and expected cuts to federal Medicaid funding, as reported by local news outlets. New York. The Medicaid reductions led Kaleida Health to announce the closure of a family planning clinic in Buffalo, New York, by year's end. They've already shuttered 2 therapy clinics in upstate New York due to the same funding hits. Oregon. Providence Seaside Hospital, along Oregon's coast, had been contemplating ending its inpatient maternity and newborn services even before the bill's passage. But a spokesperson emailed that the legislation sparked a profound overhaul, resulting in the ward's closure in October. Nearby Blue Mountain Hospital, close to the Idaho border, has let go of 10 staff members in response to anticipated revenue losses. Virginia. In Virginia's Shenandoah Valley, Augusta Medical Group is consolidating by shutting 3 primary care clinics to streamline services. Washington. Seattle Children's Hospital in Washington state is planning to cut over 150 jobs, about 1.5% of its staff, and eliminate 350 vacant positions to cope with the changes. These real-world impacts paint a picture of a healthcare system under strain, where policy shifts can erase access for those who need it most. But is this the right trade-off for budget savings? Critics argue it prioritizes dollars over people, while supporters see it as necessary to curb government overreach. What do you think? Does the end justify the means, or are we sacrificing health equity for ideology? Share your thoughts in the comments. Do you agree with these cuts, or should we rethink how we fund vital services? And could there be a better way to balance fiscal responsibility with compassion?